Viewers who are coming to us through Charlotte County TV, Channel 20, Collier County TV, Channel 97, Lee County TV, Channel 97. Our program today is called Healthcare Symposium. We want to thank our sponsors, Lee Memorial Health System and Christine Matthews Bail Bonds. We are joined by a distinguished panel of health leaders from Southwest Florida who will be discussing the current status of healthcare in our community and the resources available to you to stay well and lead a healthy life. Our discussion about wellness programs will be led by Stacy Deffenbaugh, who anchors NBC2 News at noon and covers health stories for the station. Stacy arrived in Southwest Florida 8 years ago from Fargo, North Dakota. She has been recognized for several reporting stories and for volunteer work with the American Cancer Society and the Children's Network of Southwest Florida.
Thank you. Welcome to our panel. A quick introduction of everybody. We have Leslie Amrich, who was born and raised in Kansas. She studied family studies and community service at Kansas State University. After graduating with a BS, Leslie moved to New York City to study musical theater with the Broadway Theater Circle in the Square. After getting married, Leslie moved here to Southwest Florida, and she has worked for the American Heart Association as a senior Heart Walk director for over 5 years now. Leslie works on the Lee County Heart Walk. She's very passionate about her work for the AHA, as her father is a heart survivor. Dr. Judith Hartner has served as the director of Lee County Health Department since October of 1992. Her career before moving here to Fort Myers includes leadership positions in public health in Arizona and almost 10 years of clinical and preventative care in the Indian Health Service, also in Arizona. Dr. Hartner is a graduate of Hahnemann Medical College and Hospital, the University of Hawaii School of Public Health, and Florida Gulf Coast University. Wayne Nagy is the Director of Food and Nutrition Service Department for the Lee County School District. Wayne has been in education for 38 years, including 14 as a school principal and 7 years as the leader in the areas of health and nutrition. He's also served as the president of the Florida Association of School Administrators. His Healthy Living Lab concept received the United States Department of Agriculture Best Practice Award for 2011. Dr. Sal Lacanina is a native New Yorker and completed medical school at NY College of Osteopathic Medicine and Internal Medicine residency at the State University of New York at Stony Brook. He has practiced internal medicine since 1993 with an emphasis on preventative care. He has been the medical director for the Lee Physician Group for the Lee Memorial Health Service Home Health Agency for the Employee Health Departments of the Lee MHS and the Wellness Centers in Cape Coral and Fort Myers. He is currently the VP of Health and Wellness and is developing a preventative health program for the 10,000 plus employees of the health system. Dr. Lacanina is a regular on Fox 4 Rising and often writes for the News Press and the Cape Coral Chamber of Commerce. Also today we have Dr. Jose Murillo, who is the Chief Executive Officer of the Charlotte Regional Medical Center, and Beth Jameson, who is the Director of the Wellness Center at the NCH Healthcare System in Naples. Welcome and thank you to all of you. We're going to begin talking about the big picture of healthcare. What is the overall health status of our community? And I'm curious how each of you would grade Southwest Florida's healthcare system. Mr. Nagy, let's start with you.
Well, if I had to give a grade right now, it'd have to be a C minus, only because of the fact that we've got a long way to go, and things get better or worse by the moment, and I believe that we have to do everything we can to make each day a little better. We've looked at the BMI figures that we have from our children in our schools. We're getting higher BMIs, which means the obesity rate is still going up. We have an increase of childhood diabetes, and we probably could do a little better job with the number of playgrounds and healthy choices that we have available for children. And probably the areas that I would like to see improved as far as physical exercise for children would be more sidewalks and more bike paths for them. I feel if we work in those areas, we'll be definitely on the right track.
Dr. Lacanina.
I fully agree. It's really interesting to think about all of the chronic illnesses that we see on a daily basis, and the majority of those illnesses are, to a large part, preventable. You know, the diabetes that Wayne had mentioned, obesity, hypertension, cardiovascular disease, and even to some degree cancers, you know, are somewhat preventable. So I think we really need to do a much better job at teaching people how to stay healthy instead of waiting for them to get a chronic illness and then trying to treat them as best we can. So again, and we'll probably talk a little bit more about this, the foundations of nutrition, healthy nutrition and exercise. I hope we can discuss that today.
All right. Beth Jamison, your point of view from Naples of the healthcare system.
I have to slightly disagree because Collier County is #1 in the state for health outcomes. So I think maybe we're doing a little bit better job. I still agree that there needs to be more access for children and the preventable diseases that we do see. However, I do believe it is improving. We're doing well.
Leslie.
The American Heart Association, when we see the statistics for Lee County specifically, heart disease is definitely still the #1 killer by far for people who live in Lee County. And like my counterparts, we believe we need to focus on physical activity and healthy nutrition, and do have a particular focus on children as well and what they're doing with the families.
Right. Dr. Hartner.
I guess I'll agree with Mr. Nagy's C-. And we're doing some things very well. We're doing a great job of immunizing our children against preventable diseases. We're not doing a good job in chronic disease prevention. We're not doing a good job in injury, death, and disease prevention. So on balance, I'm going to give us a C-. We have a lot of work to do.
Dr. Murillo.
I appreciate the title, but actually I'm not a doctor, so I do appreciate that.
In my notes, sir, I apologize.
All right. I'm not that good. I'm lucky enough to be I really feel blessed to be the CEO of a hospital within a community, Punta Gorda, that I think I would consider to be the active elderly that live there. One look around the town, and you know, they're creating more sidewalks. You'll see people around exercising on a regular basis. I mean, we're getting better. There's a lot of work that needs to get done, and I agree with Dr. Hartner in that, you know, especially when it relates to chronic illness and so on. So if I'm going to grade it, I'd give it a B- right now.
All right. A lot of you saying there's work to be done. I'm curious how you feel Southwest Florida stacks up to other communities in Florida. Anybody want to jump in on that?
Well, I will jump in because for the last 2 years, with funding from the Robert Wood Johnson Foundation, the University of Wisconsin has published a paper that ranks the health of every county in every state in the country. And so when we look at Florida in particular, Collier County is the healthiest county in Florida. Lee County and Charlotte County are coming in right in the middle. When we look at Hendry or Glades counties with the immense economic challenges they face, they're down there toward the bottom. So I'm back to my C average here.
Anybody else want to weigh in on where you think Southwest Florida stacks up with other parts of the state?
Well, I just look at the economically needy. We have a lot of free and reduced lunch participants in our districts. Matter of fact, we're at 69%. 69% of our children qualify for free or reduced lunch. So I know that there are food compromised families out there, which means there's nutrition concerns. That's why our main goal is to try to make sure that we serve nutritious meals, breakfast, lunch, and snacks whenever possible. And we'll talk more about that later.
Well, indeed. Beth, I'm going to put you on the spot. Collier County, Naples, #1. What do you feel Naples is doing right to earn that status, that title?
Access to excellent health care. You have NCH in the area, so that certainly does help. Just being the focus that we've had of trying to get out there. I'm not too familiar with what the school systems have been doing, as I'm relatively new to this arena. But they are trying to focus on getting better foods in the school systems, and not only reaching the children, but also, you know, the older adults as well. Mm-hmm. And it seems to be that, for whatever reason, access to the great parks and recreation systems that we have down there, that probably plays a big role in it.
Mm-hmm. You all have a passion and bring something different for nutrition, healthcare, promoting a healthy lifestyle. Explain to our viewers how each of you work together to try to make Southwest Florida a better place and to help people live a better lifestyle.
Well, I can give you an example. One of the examples is our program called Fit Friendly that we developed. It's a great collaborative program that we have. As a matter of fact, our particular program in the Lee County school system is called Actively, and it has Actively Start Fit Friendly, and it actually qualified in the platinum level for the particular Fit Friendly programs that are available. And the reason we were able to do that is we get great cooperation from our counterparts and the other people that work within the area. And along with that, we have the Hunger Task Force, where we all work together as a group to try to work on the hunger situations. We have a program called Fuel Up to Play 60, which is dealing with food and exercise, the fuel and the Play 60. We have Farm Fresh to School programs, school gardens, and here again, we can talk about that more in detail later on.
Okay.
Stacey, I'd like to add, the issue of working together is really important for a healthcare community, because we do a great job of providing care in very isolated areas. And oftentimes we really don't have all of the healthcare providers, which are so many people, really involved in making sure that we have great continuity of care, so that when that person comes out of the hospital, they get good home care, they get back to their physician quickly, that the care itself is organized through an electronic medical record. So until we really can get to that point where we're really able to share information, I think we still have some things to do, but working together and providing real continuity of care is very important for a community.
Anyone else on that point? Yes.
Probably one of the best ways, I think, is organizations, for example, like the American Heart Association, that in the spirit of good competition will work with different hospitals, different businesses, and so on, all towards one common cause. So I think that's a perfect example of how we can cooperate.
As the American Heart Association, we're so happy to be partners with everyone at this table. And we come together, different communities and projects like the Fit Friendly Southwest Florida, where we really take a look at how can we encourage people to be more physically active with walking paths or walking clubs, and how do they have better nutritional opportunities at school and at work, and what can we really do at a grassroots level to make a difference for the people in our communities. And the American Heart Association is so thankful to all the partners that allow such wonderful things to happen. Like Wayne was talking about our Fit Friendly recognition, the American Heart Association recognizes companies twice a year and communities that go above and beyond in wellness, and the Lee County School District is one of them, and they are a platinum level, which is our highest recognition. We actually have 11 of them in Southwest Florida. Lee Memorial is one of our gold level. Hope Healthcare Services is a gold level. Fowler White Boggs Banker PA is a gold level. The school district, of course, is a platinum level. Fowler White Boggs was just upgraded to the platinum level as well. So we have 2 platinum level companies now. The Lee County government is also a gold level. The Lee County Health Department was just awarded a gold level. Chico's FAS is a gold level. And then in Collier County, we have Gulf Shore Insurance, the School Board of Collier County, Physicians Regional Healthcare System, and Arthrex, who are all at our gold level. And this program asks the communities and the different organizations to rate themselves in 3 different areas: physical activity, nutrition, and culture. And it's asking questions like, do your employees have an opportunity to walk at work? Can they wear shoes that would allow them to exercise during certain points of the day? Are they allowed to take the stairs instead of an elevator? Are there nutritional opportunities for them to make a healthy choice? And there's different areas for the company to share some of the creative things that they're doing, within their organization. And the Heart Association has seen a lot of success in this program, and it's part of how we're hoping to increase, prevention in America.
Any other programs, that was a good segue, that you all would like to get out and let the community know that your organization is doing? Because you all are doing wonderful things, and a lot of people unfortunately may not know about some of the great things available right here in Southwest Florida.
NCH does 2 programs a year. One's called Girls Night Out, happens in October, and the other one's Day of Dance, it happens in February. And the point of these programs is health-utainment, they'll call it, where it's not only an entertainment portion, but there's the education portion. The Girls Night Out was an event that was held during the work week at night. We had massage therapists there and different sort of vendors there that were helping people understand how in the community you can use these things to better inform you on your health. And then we had doctors speaking as well. The day of dance was really a lot of fun, where we had a physician speak and then a dance group where everybody got up and danced, and there was about 600 people in the ballroom at Naples Beach Hotel, and it was free. So it was for people to come out, and you got, a free advice from a physician, which was quite helpful.
Right.
What other great programs?
Well, at Lee Memorial, at the health system, we're developing a health and wellness program specifically for our own employees. It really is sad to say that despite the fact that we work for a health system, our population of people are probably no healthier than the population in the community in general or the nation at large. So we deal with the same problems that we mentioned. All of the same chronic illnesses afflict our employees. So we've designed a health and wellness program that is fully supported by the health system to help our own employees become healthier. And what someone mentioned before about developing a culture, I think it really is important for organizations to develop a culture of good health. And people really should become role models for healthy living. And that's one of the things that we're trying to work through in our own organization. And we've actually been contacted by a number of other companies in town that are interested in doing exactly the same thing. I met probably 2 months ago with a small company in North Fort Myers where they have about 38 employees. They have a 50-50 split in their healthcare premiums, and their premiums are going up 65% this year. So they're all panicking and saying, what can we do to stay healthy so that we don't have to worry about these premiums going up and up every year? So any corporation can really take advantage of these programs.
Large or small. Right.
Large or small, exactly.
Just to cover some of the things that Sal was talking about in the school system, we do have a wellness program. We actually have a full-time wellness coordinator. Her name is Lisa Brown. And we have programs going on every single day that are dealing with health challenges and weight management and appraisals and biometrics, all types of tobacco cessation. And it is very important to our employees. We want to have them, one reason is we want them to be as healthy as possible, is we want them to be there every day. Because if teachers are there and they're the professionals and they're teaching children, we're in good shape. If a substitute's there that doesn't have a good background, the children don't get the same information that particular day. Also, it's economics. We have the same concern that our health insurance is going up, and we want to help keep our workforce healthy. Just to give you an example, last year through our Weight Challenge program, the individuals who were involved lost a total of 4,200 pounds. That's 2 tons of weight that was dropped during the program. Right. So the programs do work.
Right. And Wayne's point is real. I'm sorry.
And I would like to, not the healthcare system, I want to give some credit to planners and policy points. Mm-hmm. We're seeing Lee County government in particular make good policy choices that in the long run will enable wellness. Policies about not smoking on county government property, policies such as adopting the Complete Streets resolution, which will move and recognize that as you build a road, fix a road, you have to make sure that that road is accessible not only to automobiles but to bicycles and to pedestrians and to people in wheelchairs. The Metropolitan Planning Organization, which plans for all of Southwest Florida, has a bicycle pedestrian master plan now that again looks at doing some of those same things. As we build our environment, let's build an environment that promotes health. All of these underlying changes are good and what will be the foundation for a healthier Southwest Florida.
So it sounds like there's partnerships outside of the health community that are important for this to work in our community. Let's talk a little bit about obesity and weight management. Obesity is certainly a major concern all across our country. We are the fattest country in the world. I don't need to tell our panel that. A recent study looked at the health status of Lee County, and it found that two-thirds of adults are overweight or obese, an increase in the last study, which was done in 2007. What can we do as a community to reverse and stop that trend?
Wayne, I want to get back to just Wayne's point because it actually answers your question to a degree. The wellness coordinators that he mentioned, most people know what they need to do to get healthy. but oftentimes we don't internalize that enough into our own lives to actually get things done for many different reasons. And the wellness coordinators, and we actually call them wellness coaches in our organization, are really helpful to teach people how to make lifestyle changes so that they can include those things into their life. So it was interesting, one of our coaches was talking recently about changes in nutrition, and the way she talked about most people in this country know how to eat meat, but we don't know how to incorporate produce, fruits and vegetables into our diet in an easy and an effective way. So I think, to battle the epidemic of obesity and diabetes, which is occurring because of that,
Right.
we really need to help people make lifestyle changes that they can actually do on a daily basis and make it just a part of their daily living.
Wayne, I'm curious from your point of view, you see kids much younger in the school system. Is obesity a problem for young kids here in Southwest Florida?
Absolutely. We have a number of programs that we work with children on trying to make sure that they understand what they need to do to lead a healthy lifestyle. But just looking back at the big picture, the United States Department of Agriculture put out for decades now the food pyramid. Well, most people look at the food pyramid and they see something that looks like it's supposed to be from Egypt. They don't really get an idea how it fits in. So now they came out with the My Plate concept this year, which I think is a great idea. It shows 50% of the plate covered with fruits and vegetables, the other 50% covered with grains and lean meats, and then an area for dairy. So it's a lot easier to understand, and getting away from all the pages and paragraphs of information that they had that they expected the common person to read. Now these are their basically guidelines. Enjoy your food, but eat less. Avoid oversized portions. Make half your plate fruits and vegetables. Switch to fat-free or low-fat 1% milk. Compare sodium in food like soup, bread, and frozen meals, and choose the ones with the lower numbers. Drink water instead of sugary drinks. Simple, basic things that people can understand on a day-to-day basis, and if they get in the right habits, it'll help us out a lot.
To be teaching people how to live in their bodies for 100 years, you have to give them things that they can relate to, because American society is very instant gratification. I want it now, and I put these 50 pounds on, and I want them off tomorrow. And to educate people of how to do that, one needs to be easily attainable. They need to understand how to do it. But it not only needs to come from our healthcare organizations and our county health, but news outlets. It helps if the papers are reporting on it and the local magazines have sections about it, or our media, our Facebook pages, our websites, places where people can go to figure out how to do this, because they know they have to lose it, they know they have to live a healthier lifestyle, but the end result is almost daunting to some people. Mm-hmm. So making things exactly what you're saying, the food changes to the food pyramid, where they show you a plate. They don't tell you how big the plate is, of a normal dinner plate, but at least it's getting people thinking in the right direction.
And Beth is so right. I meet a lot of heart survivors and a lot of people who have made lifestyle changes working for the American Heart Association. And a lot of times they'll say, I was just overwhelmed, but one day I got up and I walked to my mailbox, and that's all I could do. And the next day I made it to the end of my driveway. And the next day I made it to the end of the block, and a year later I lost 100 pounds. So, Heart Association really promotes walking, and I know our Fit Friendly Southwest Florida does as well, because we live somewhere beautiful, and it's something simple that most of us can do, and we can start small, and build. And the American Heart Association has a free website. It's www.startwalkingnow.org. And on that website, we've got all kinds of tips for walking, healthy recipes. You can connect with other people in your community who are doing the same exercise programs that you are, and it's a totally free tool that is accessible to, anyone who can get on the internet and, start small and build upon that, because absolutely it's overwhelming for people, in the beginning.
And to go on your topic of living in a beautiful place, it's 99% of the year it's gorgeous here. And when you look at an obese person, it's painful for them to walk a lot of times, even sit, lie down. So if you can get them weightless in water, which we have a lot of down here, it at least helps them to get moving. And it said, I think it's every pound that a person loses takes 4 pounds of pressure off of their joints. So just start small. Start thinking what you can do. You change out your sugary drink for water. You live in a hot environment, drink more water. And it'll add up, and it just is a frame of mind, and also our culture of it's not going to change overnight. Just be proactive.
Dr. Hartner, you've been in your position since 1992. Have you noticed this obesity issue getting worse over the years?
Certainly, we've seen it here, it's a national trend. The CDC publishes maps that show the percent of obese people by state. And they did their first map in 1985, and there were a couple light blue. And they went through all the shades of blue, and still people were getting fatter, and they moved to orange, and I think we're now up to magenta. The bottom line is that in the whole United States, only Colorado has a percentage of obesity less than, I think, 15% of the population. Wow. And take a minute, why Colorado? Because people are active.
Mm-hmm. Dr. Lacanina, I'm going to put you on the spot and ask you to explain the difference between being overweight and obese.
Sure, yeah, and that's a great point to discuss, because people really need to understand the definitions, you know. And basically we use the BMI, the body mass index, which compares your height and your weight. So if you're 6'5" and you weigh 240 pounds as opposed to 5 feet tall and weighing 240 pounds, there's a big difference there. So we take a BMI of less than 25 as being normal, 25 to 30 is considered overweight, and greater than 30 is considered obesity. The one thing that you really have to be careful about, though, with using the BMI is there are certain people that are heavier but have a lot more muscle mass. And it's one of the things that we try to emphasize in our wellness program. When people are losing weight and when they want to become healthier, they really need to replace the fat cells with muscle mass, because that's really where most of the calories are burned. So, you know, we don't want to just focus on weight or BMI. Add in a percent body fat measurement, which there are certain scales that allow you to do that. And I think it gives people the information to really make some changes in their exercise routine. We see a preponderance of women that as they get older, they do no weightlifting. They do the majority of their exercise as aerobics. So they're either riding a bike or walking, doing things like that. And they forget the weightlifting, which is really important to maintain good skeletal muscle health, because again, that's where your calories are burned. So, you know, you can give people information about their weight and the BMI, but then you need to give them the tools and the information to do something with that information.
So as a medical doctor, the people sitting at home right now that know that they are overweight or obese,
Sure.
Leslie talked about getting up and walking. Is
Right.
that a good place to start? Just start moving, walk down the street, walk to the end of the road, and keep going? I mean,
Right.
Is that how you tell somebody watching right now to get started?
I think it was a perfect point, because you really have to start small. You know, if you know that you have 10 things in your life that you have to change, you're not going to do all those 10 things tomorrow. But if you can take one thing and, just like she mentioned, just decide that you're going to drink water instead of a sugary drink, that really makes a big difference, because then you get a small win that makes you motivated, and then a week from now you may add the second thing. So small gains really in the long run make the difference, because it has to be a lifestyle change, something that you will really stick with in the long run. You can't just decide, I'm going to go on this crash diet, because you'll lose weight, but then 6 months from now you probably gain more weight back.
Beth, the little things like parking farther away at work, even though we all like to be close, and taking the steps, does stuff like that really help?
There was an article actually put out, I think it was in the Associated Press a couple days ago, about how they want the average American to include 2.5 hours a week of exercise, and that's quite a daunting number for people. But they also mentioned that the importance of 10 minutes a day, and that 10 minutes a day can be that you walked up and down every row in your grocery store, and you parked further away. You took the stairs at work instead of the elevator. You walked your dog. You went to the mailbox. Things like that. Yeah, they do add up, and as little as 10 minutes a day.
Anybody else want to weigh in on that?
One thing I can mention, besides being a CEO, I'm also a physical therapist, and back in my time at the Wellness Center there at Charlotte Regional Medical Center, we had a weight loss program that touched on every one of the topics everyone talked about here. Keeping it very simple, parking farther away. I mean, what's the first thing we think about whenever we're going to the mall is we want to find the closest parking spot. Well, that's actually the worst thing you can do. And heck, you could save your car by parking farther away, you know, other people bumping into it. But steps. We would measure through something simple like a pedometer, so that we encourage them, if I measure how many steps you take in a day, and if all you did was 2,000 steps today, then let's see what we can do to increase it to 3,000. And little things like that increase the activity level, and it does work. Eventually it turns into somebody being in a full-fledged program.
Right.
If I can, in our Fit Friendly Coalition, 2 wonderful ideas have come up. The first is to ask retailers to become fit friendly and to designate fit friendly parking squares as far away from the building as possible. And then the other idea is that we should have to put parking meters on the close squares and no parking meters on the distant squares.
That's a great idea. Dr. Hartner and others that have mentioned is talk more about what Fit Friendly is for people that may not know what that is when they're watching.
Fit Friendly is a new coalition. It has grown out of a partnership between the American Heart Association and Lee Memorial, and then the Lee County Health Department joined, and the school district and companies. And what we're really looking at is long range, how do we change expectations and how do we change policy and environment to create good nutrition, opportunities for exercise, those kind of social policy changes that I was talking about. So it is, it's a very long process. I in my mind, compare it to what we've done for smoking. 30 years ago, smoking was common, everybody smoked.
No. You see somebody smoking and you're saying, oh, they smoke.
But what happened? 2 things happened. We learned smoking was bad for you. Healthcare providers started to tell people to stop smoking, but most importantly, we adopted policies that made it difficult for you to smoke. No indoor smoking, no smoking on the campus, all of those things. We have to do the same thing for physical activity and nutrition, but in reverse. We have to make policies that make it easier for you to do the right thing.
Some of the partnerships with the American Heart Association has nationally are with restaurants like Panera, where they're posting the caloric value of all the foods, and it's quite shocking. Some of the dishes that you think are healthy, in all actuality, it's your caloric intake for the day there. And the more, as Dr. Hartner was saying, the more people can have the information to make informed choices, especially about what they're eating, whether it's calories or sodium, the better we're all going to do.
Right. Have you seen the book Eat This, Not That?
Yeah.
That is just so
Puts it into
telling.
perspective.
I mean, it really does. I mean, there's foods that we eat that we don't think twice about, the calories in there and the fat grams and all. So, obviously education is a big part of what we all try to get out to the public. And you read books like that and you say, everybody needs to look at this book because it really is eye-opening for everyone.
And Wayne, is it my understanding the school district is starting to remove the fryers from some of the cafeterias?
We have a number of programs that we're doing right now to help children. First of all the fryers, there are no fryers in the school, so nobody can come up and call me up and say, I don't like the fried food you're serving the children, because we don't have any. And also have a full-time dietitian to make sure that every single meal we serve for breakfast or lunch is at least meets or exceeds all USDA dietary guidelines for healthy Americans. We limit the amount of starches, we've added more broccoli. We could go on, but just an example for the fresh fruits and vegetables, we're going to spend $1.2 million next year just on fresh fruits and vegetables for children. Every day a child will have either a fresh fruit for breakfast, lunch, or both.
I think you can read my notes because I was going to move to fruits and veggies next.
I've got more.
I know Sal brought this up earlier. We all know how to eat meats, but we can't seem to ration and figure out how to get fruits and vegetables into our diet. I'm curious the barriers you think in our community, why we can't seem to be able to do this as a community.
It's not only getting to the point where you can eat them, but first you have to get them into your home. And what we see, and I think the panel before ours brought up the issue of in the areas of the community that are not so affluent, they don't have all the access that they need to healthy foods. And that really is a big problem, and that as a community is something that we really have to deal with. should we develop some sort of a mobile pantry? And actually through Fit Friendly, we've been discussing this issue. How do we get the fresh fruits and vegetables to the people that need it the most? There's a significant incidence of obesity and diabetes in the lower socioeconomic areas. So how do we help them achieve those goals? And many people will say eating healthier is more expensive. To a degree, that's correct, depending on if you go to the grocery store to buy your fruits and vegetables as opposed to going to one of the outdoor markets. So we need to solve that problem.
Just an example, in the school district, it costs us about 36 cents to have a portion of fresh fruit for the children. Canned fruit we can do for 11 cents. So when you serve 12.2 million meals a year, that adds to over $3 million in additional costs. We believe it's worth it, so we set a business plan up that would be able to let us do that. But it is significant when you look at the total cost impact for our district. But every family has their food budget also, and they have to make their pennies stretch.
Sure.
I know in my household, particularly, my husband's very passionate about half of the plate being fruits and vegetables, and it is a challenge. You have to try. You have to want to do it. But he always talks to me that every dollar we spend is a vote on our food. And yes, it's more expensive and it affects our family budget, but when we go to the store, we're telling them this is what we want, to have available to us, and hopefully at a more reasonable price.
Dr. Hartner, at the health department, I'm guessing you see folks at that lower economic level. Do you think it's a barrier in our community getting folks at different income levels to get fruits and veggies in their diet?
It is a barrier, and though we talk about fresh fruits and vegetables, canned vegetables, if they're not heavily laden with salt, frozen vegetables are vegetables. And we need to, again, fix that plate, make it possible so that maybe you can't store a lot of fresh vegetables, but you can store low-sodium canned vegetables. You can store fruit not in heavy syrup. So there are alternatives, and we need to help sort of allow people to see those alternatives and to adopt to them. If I can, I'll talk a little bit about the WIC program. WIC is Women, Infant, Children Supplemental Nutrition Program, provides supplemental food for pregnant women, nursing women, and children up to age 5. Until about a year ago, the WIC food package, as prescribed by the government, was heavy into whole milk, beans, cheese, and the whole food package, the whole amount of foods changed so that now WIC does buy 2% or low-fat milk. WIC does buy fresh vegetables. It does buy canned vegetables. Continues to get multigrain, high-iron cereal. So we as a nation and the USDA have noticed that even some of our governmental policies were contributing to the obesity problem, and that has changed. So there are means to get better foods for low-income families, especially for low-income children.
Mr. Murillo, in Charlotte County, what are some of the barriers to get folks to incorporate that healthy food, do you feel?
She touched
Similar
on
to
some,
what we've heard?
Yeah, she touched on some of them. Unfortunately, there is a population that's not as well to do, and they're going to have some challenges in terms of the choices they need to make. So we need to do a better job of educating them properly, because they can still make good choices. We just have to show them how, and so that challenge is certainly there in Charlotte County.
Right.
As healthcare folks in the healthcare industry, are you encouraged when you see fast food restaurants starting to modify their menus a bit, or do you think we need to go a lot further than where we are now?
Well, it's a small start. I mean, there is at least one thing that you can get at McDonald's now that's healthy.
Right.
Their smoothie is actually a healthy drink, so it's a start. And again, getting back to Dr. Hartner's point, maybe fresh fruits and vegetables is the goal and the end point, but you can still get some significant benefit from the canned. And to Wayne's point also, obviously there's a big difference in the price, but maybe we should see that as one step closer towards the end goal. And so, the restaurants that put up the nutrition signs, the calories, the fat grams, everything else, the fast food places that have at least one thing on their menu that's healthy, that may be the leader to get people in to buy the other stuff, but if you make the right choices, I think it's in the right direction.
We're still a nation of convenience, so you're still going to have fast food restaurants, and if they're going to be offering the healthier option, and also I was at Subway the other day, and they had put, if you're trying to have a lower fat, sub, put these ingredients on it. So that was helpful. It was right there as you were building your sub. I mean, you could say, oh, choose this and not that. So things like that are going to help people at least make a better choice.
Well, I want you to know that my 3 grandchildren, the oldest one, who's going into kindergarten, wants to go to McDonald's because he gets the toy or the movie novelty. And it's not really what's in the food as it is the marketing techniques. So they're still using marketing techniques to bring in young children to possibly eat foods that aren't as good for them as possible. They do have choices now, though. They have the apple choices, apple slices as opposed to the fries. But you have to really convince your kindergartner to get apple slices versus fries. Although if they're educated, that's in their best interest from the time that they start eating, it does make a difference.
And that can be tough when mom and dad are working 2 jobs. And
I have a 2-year-old, and that was my goal, that he would not know what chocolate was for a while. He would never know what soda was for as long as I could possibly put it off. And his treat is yogurt. So I'm hoping it works.
But Wayne's point is really interesting. If you look at dollar per dollar what's actually spent on education for healthy nutrition, and you compare that to the advertising dollars from restaurants and the food industries, the last statistic that I had read, it was $1 for $24. So it's very hard to fight against that when they're spending so much more money to educate people or to influence people to come to McDonald's for that toy. And I don't want to just pick on McDonald's, but obviously that's one of the things that gets the kid to bug the parents to get them in there. And it really is something, again, maybe that's related to policy changes that Dr. Hartman mentioned. Maybe there's some way that we can control the amount of advertising for unhealthy behaviors. You see what they're doing now with cigarettes, which is phenomenal.
yeah. Let's move on to obesity and diabetes, a close association between those two. The Community Health Assessment recently found that the prevalence of diabetes in Lee County is higher than any other area of the state. Let's first start with, what is diabetes?
Diabetes, very quickly, is your body's inability to use insulin for fuel. Not insulin, sugar. Sugar for fuel. To make sugar into fuel, you need something called insulin. There's actually 2 types of diabetes. The one type in which the body just doesn't make insulin. And then there's the type where there is enough insulin, maybe even too much insulin, but because the fat cells are swollen, the insulin isn't working. And it's this second type of diabetes related to obesity that is our concern. It used to be, we called the first type childhood onset or juvenile diabetes, and we called the second one adult onset diabetes. Today, what we are seeing is children with the second type of diabetes because of obesity. And that's the focus. And then when you add to, and Dr. Lacanina can do this better than I, if you add to obesity and diabetes, hypertension, because the bigger the body, the bigger the circulatory system, the harder the heart has to pump to move stuff around. Now you have 3 chronic diseases all wrapped up in one package. Keep going, and your body, because of the way the insulin has changed, is now not processing fats right, and we start talking to you about your cholesterol being too high. It's a chain reaction that is frightening, and what is probably more concerning is that we're seeing it in younger people.
Right. And you really hate to try and educate people based on fear, but when you look at the complications that occur from diabetes, it's the leading cause of blindness in this country, leading cause of amputations, and the leading cause of kidney failure. So it's not just the fact that you have this problem with metabolizing sugar, And it's really interesting the way, and maybe it's a southern thing, but I see a lot of patients that come into the office and you ask them about diabetes and they say, oh, I just have a little bit of sugar. You know, and I really hate when people say that, you know, and hate when physicians let patients say that, because it really minimizes the problem. And I think as a chronic illness, if I had to choose the one that I would not want to get most often, it would be diabetes, because there are so many complications that occur from diabetes that it's really so frightening. And we really need to do a better job of educating people what diabetes is all about and what complications occur from that. It's estimated that you lose about 6 to 7 years of life from being a diabetic. So that's a lot of years lost.
How do people manage it? What is the best way to manage it?
Don't get it.
I really think the foundation, again, gets back to healthy nutrition, daily exercise, keeping your body weight as close to an ideal body weight as possible, because as Dr. Hartman mentioned, it really is a problem with what they call insulin resistance. You may be producing enough insulin, but your body doesn't know how to handle it. So the foundation for treating a diabetic is the same as the recommendation for anyone else that you want to keep healthy. Eat right on a daily basis, eat healthy, make the right choices, exercise every single day, do 10-minute blocks or 30 minutes at a time, and making healthy choices and habits a part of your daily routine.
Dr. Sal talked about the years of life that you lose with diabetes. The Heart Association has a statistic that we like to say 2 for 1. So for every 2 hours of exercise, you gain 1 hour of life. With that simple and inspiring, when we can flip that to a positive, that so many of these chronic diseases, we can do something about it. All of this is horrible news, but the good news is it's something that we can change.
Right.
And the good news is, too, every disease known to man, mental, physical, can either be prevented, treated, or cured by regular activity. I mean, it really is the best medicine, is to stay active.
Back when I was practicing physical therapy, wound care was one of my favorite areas, and truly sad to see the amount of wounds that simply would not heal because of diabetes. And the prevailing thought for all the therapists there was simply, we could have avoided this, and so prevention is the key.
Mm-hmm.
Let's talk about all of us have full-time jobs. People watching, some people have 2 jobs, some 3 to make ends meet, and a lot of people say it's hard to find that time to exercise. Life is hectic, kids, jobs. Companies now implementing employee wellness programs that are making it convenient to work out. Tell me about some of the programs that are in our community right now.
The Heart Association works very closely with Chico's. They're headquartered here in Lee County, and they have really done a wonderful job in making physical activity and wellness a priority for their employees. In fact, they've just opened their own wellness center on campus. It's a beautiful gym. I've been able to tour it. They encourage employees, if they're feeling tired or sluggish during the day, to take the time, go work out, and come back. They also have an on-site clinic for their employees as well. So, they see the benefit not only, in productivity but also in the money that they save in healthcare costs when their employees are healthier and more physically active. We have companies locally in Lee County that have seen a 40% decrease in healthcare costs when they implemented a wellness program, which that's substantial.
Any smaller companies? Chico's is a
big company, and one of the companies that I can think of is Edison National Bank. They partner with the Heart Association in our wellness programs for years and have seen wonderful results as well, and they're a smaller local company. So everyone sees the benefits, because workers who are obese cost companies more money. They're gone and they're sick more often, and they're dealing with these chronic diseases that we're talking about. So yes, we've seen the benefit of that investment in our community.
And companies can promote activity at work with hardly spending a dime. At the Lee County Health Department, our health educator discovered that if you walked the perimeter of our parking lot 4 times, you've walked a mile. Didn't cost us anything other than her time to measure the distance.
All you have to do is bring your tennis shoes.
So all you have to do is bring your tennis shoes, take your 15-minute break, and rather than drinking a sugary drink in the employee lounge, walk around the parking lot. So downtown businesses can map out a 1-mile walking course doesn't really cost anything other than a little bit of promotion and a little bit of imagination.
I think that's a good point, and not to take anything away from our wonderful health clubs in our community, but some people that's just not in their budget and an option for them. So doing the little simple things can really make a big difference.
And in Lee County, we have over 64 free walking paths. Dr. Hartner is referencing one of them that are listed on that startwalkingnow.org, where you can say, this is my zip code, where can I go walk that's safe and free?
That's what I was going to, I don't mean to interrupt, but if somebody's watching and they say, I would love to go walk every night with my husband, is there a
Sure.
place
The
they can go?
website that I referenced earlier, www.startwalkingnow.org, and there's a place where you can put in your zip code, and all the walking paths that surround your zip code that are free and safe will pop up and you can see them.
Dr. Sell, the weightlifting, I know you mentioned. What can we grab around our house that could service something if
Children. Children.
if hand weights or free weights are not an option in our budget? What silly or what out-of-the-box things can we do?
Yeah, well, I've heard people do exactly that. They'll get one of the shopping bags, the heavy shopping bags that you can get from the stores, and put a few cans in there, and you can lift those as weights. So you can do a lot of different things, as Dr. Hartner had mentioned. I mean, you don't have to be part of a gym to do all of these things. You can walk up the stairs in your house. You don't have to go to the mall just to shop. You can go to the mall and walk around. It's an air-conditioned, safe place. In most cases, they probably won't throw you out for walking in there for 20 minutes, you know. My mom does that. She's done that for years. You know, she just goes to the mall in the morning and she walks her few miles and gets her exercise. So you can, with
See
imagination.
the latest styles, do some window shopping, right?
Exactly, right.
We encourage local businesses as well. If you know you're going to have a meeting where you don't need to be in front of the computer, take a walking meeting. Take a walk around the walking path when we're having our beautiful weather. You can still talk and honestly maybe accomplish a little bit more. So the more we can be creative to say, could I do this? Standing up and moving, the better.
And Wayne, I'm going to get back to you in a second, but anybody, but Doctor, I'm looking at you. I know I feel better when you move and there's something in you that gets
Absolutely.
going. Is there truth to that, or is that just mental, that you just feel better when you get up and out of your desk?
No,
and move
absolutely.
around?
Right. There's endorphins, there are chemicals that are released in your brain when you exercise that actually make you feel somewhat euphoric after the exercise. And people will get addicted to that in the sense that on the days that they don't exercise, they don't feel as well. So there is a chemical response to exercise that, it's a known physiology.
Do any of you feel your employees are better employees and more productive and more positive people when they're exercising and being
Absolutely.
fit?
Yeah, absolutely.
And we have, for example, our school board office was actually an old mall at one time and actually a flea market. And we turned it into a school board office to save the taxpayers money. But because it's laid out into long passageways, well, we have a health culture now with our wellness coordinator that it's common practice when you have a 15-minute break, you don't go sit in the room and drink coffee. You go out with your tennis shoes and you walk up and down with some of your friends at work, and you get a chance to talk, you get a chance to move. And when you're working in a cubicle, there's nothing better than getting up and going down an eighth of a mile stretch to loosen up, and you do that 8 times, you've got a mile. So yes, it can be done very simply, and it's a habit situation. I find the same people going out every day on the break to take the walks.
As you were mentioning of, the time excuse and working, having kids, 2 jobs, 1 job, or whatever. Where I work, I actually meet people, I'd say every day, but I see them every day. And I met this one gentleman in particular, and he said he was 74 and he'd had a stroke. And he said, if I had known I was going to live this long, I would have taken much better care of myself. So the point being is that, yes, it is important to work. Yes, our budget is stretched thin, whether it's a budget of time or a budget of money, but you have one body that you're given. Treat it right. Take some time for yourself. I mean, if you do have kids, go for a walk. Go out and play with them. If you don't, I mean, whether you're, past that stage of your life, it's still important to be out. When I was on maternity leave, it was too hot, so I walked the mall too, and I must have looked crazy, but at the same time, you've got to get up and get moving. Garbage in, garbage out. If you treat your body like a garbage pit, that's what it will be.
Right, and you mentioned, the fact that people will use it as an excuse, saying,
Yep.
I don't have time for
I don't have
exercise.
time or the money.
So when I hear that either from my patients or in the lectures that I do, I ask people the trivia question, how many minutes in a day? There's 1,440 minutes in a day. So if I'm asking you to take 30 minutes out of that 1,440, you still have 23 and a half hours to do everything else that you need to do in that day. So try not to find an excuse not to exercise.
Right? It's easier to make the excuse, and then if you don't think you have time and money now,
Right.
you wait until you have diabetes or heart disease or have to get, open heart surgery or something that because you didn't take care of yourself. Think about the time and money then. It's a lot more cost effective to do
Get
it
back
now.
to that.
I heard a great analogy from one of our partners. We all take the time and the money to have the oil changed in our cars. And it's not fun and it's not inexpensive, but we know we need to do that or something horrible is going to happen to the engine, and then it's going to be a lot of time and a lot of money. And that really is a similar idea with healthcare. If we'll take the time to do those health oil changes and spend the little money, we're going to save money big time by not having chronic diseases like heart disease and diabetes and cancer.
And it doesn't mean you can't enjoy the birthday cake at the party and the ice cream, but just, it is moderation and, treat your body right the rest of the time.
I want to talk a little bit about heart disease and stroke. And Leslie, specifically, the American Heart Association has been a leader in developing heart-healthy programs. Tell our viewers what your office, AHA, offers.
Sure. We are located in Bonita Springs, but we cover both Lee and Collier County. And, we really, about 4 years ago, there was a program that began. It was called START. And the whole idea was start doing something, start walking, take that small step. And Jim Nathan and Lee Memorial, who are one of our biggest partners, likes to say that he invented START about 30 years ago and really encouraged everyone that instead of having a dinner party, let's have a walking party. So he's always been an advocate. And through that START program, we began developing these walking paths that I referenced in, the fit-friendly companies that we talked about earlier. We began this coalition that Dr. Hartner referred to. And START has now this past year for the American Heart Association evolved into a new program called My Heart, My Life. And if you think about it, there's nothing more personal to you than your heart. And without it, you will not be alive. So START has become a part of this My Heart, My Life platform. Lee Memorial is a year-round sponsor of this platform. And the real focuses that the Heart Association have right now are physical activity, nutrition, and children. And we are so fortunate in Lee County that the school district has the amazing wellness programs and food for the children that it does. But unfortunately, throughout the nation, we have a lot of children who are overweight. I believe the statistic is 1 in 3 children. Wow. It's a first generation not anticipated to outlive their parents. Yep. And the American Heart Association's impact goal at the moment is to improve cardiovascular health by 20%. So this is the first time that we have focused on prevention for the nation while reducing the death and disability by 20%. And as these young children are coming up with these chronic diseases already, the numbers are going to skyrocket if we don't do something right now. So the Heart Association is definitely focused on those areas and so happy to partner with all of the people here at the table, in the community to find ways creatively to be healthier people.
Right. And you mentioned about a national problem and national attention. And right now, certainly you can't turn on the television without hearing something about healthcare reform, which, in my opinion, is more financial reform. It's not really healthcare reform. Most people need to realize that healthcare reform starts with the individual. If we really want to reform healthcare, it has to start with you personally, and then what happens in your own community. And if you leave that up to someone else, the government or whomever, it really just does not happen. So you just need to internalize what we need to do.
Anybody else, heart disease or stroke?
Well, that's the #1 killer, in this country, and it's really interesting when you look at the press, and obviously we should make a big deal about cancer prevention and all. And there are lots of cancers that people can get despite living a healthy life. Right. But heart disease is the #1 killer in this country, and we still need to focus on the fact that it is mainly a preventable problem. A lot of people assume that as you get older, you just naturally have to get heart disease. You're going to have a heart attack, you're going to get a stroke, and that's the furthest thing from the truth. We've all seen patients that are in their 80s and don't take any medication, have normal blood pressure, have never had a heart attack, and that's usually because what they have in common is the fact that they've eaten well and they've always exercised. So we get back to the same thing. It seems like we continue to get back to the same recommendations.
Right.
Eat healthy, exercise on a regular basis. You will avoid so many of these chronic illnesses, and heart disease being the #1 thing.
I think a lot of people too think that we're just talking about those that go into the overweight and obese category. And people also have to remember that there's a term that's been out there called skinny fat, that they look and appear a healthy individual, but they're not on the inside. So just because you walk around a thin person does not mean you're a fit person. It does not mean you're a healthy person.
I think often with heart disease, and I've been guilty of this as well, when we think heart disease, we think a 50-year-old white male.
Right.
And it really couldn't be any farther from the truth. More women die of heart disease every year than men, actually. And, the symptoms for women are different than they are for men. And many children are affected by heart disease from birth as well. So we really have to broaden the idea, who this is going to touch and affect. And the great news, as Dr. Schall shared, is it's largely preventable. We can do something about it to change these statistics.
Health screenings. Let's move on to health screenings. One of the most important things that people can do to maintain their proper health, yet many people do not go to the doctor until they are very sick. What screenings should people be getting regularly, and when should they be getting them?
I'll jump in on that one. I'm sure that everybody else will add. Starting high on the list is obviously screening for heart disease. And what we generally do is start out with making sure that a person's lipid profiles are normal. We do screen individuals again for diabetes because there's such an association between diabetes and heart disease. And then other screening tests for cancers, which are really high on the list. If you want to help people stay well, you really need to look for certain problems early on. If you're 50 and you've never had colon cancer screening, that is one test that you have to do. Men should get their prostate cancer screening test done. Women should have their mammograms and their pap smears done. So there's a list of things that really should almost be a check-off list that your physician or healthcare provider goes through with you to say, are you doing the right things to screen for diseases early, to stay healthy? As Dr. Hartner mentioned, immunizations. Children get lots of immunizations, but adults also need a number of immunizations. Everyone should be immunized for influenza, for the flu every year. Adults should also get their pneumonia vaccines, their tetanus shots. Whooping cough, pertussis is actually on the rise now, so we offer that to older individuals. And shingles, is a significant problem, and there's a vaccine for that. So it's not one thing, it's really a whole list of things. And if we're going to treat people and keep them well, you really need to do similar to what pilots do. They don't take that plane off the ground until they go through their checklist to make sure that all of those things are done. So we say physicians should have a checklist of things that they go through with their patients to make sure that they're healthy.
I'm going to pick on Dr. Hartner in a minute with the immunizations, but staying on the screenings, Dr. Schall, how important is it for somebody to have a relationship with a doctor that can go over those tests and that sort of thing with you? Is that important to have that relationship, to establish that relationship?
Sure. Well, my opinion may be biased, but I think everyone should have a primary care physician that really takes the time to educate each individual, every single patient that they see. The only way that we're really going to make an impact on the health of the nation as a whole is to do it one patient at a time. And in the school systems, they're educating one student at a time. That's where you really start to see change. So I personally think that everyone should have a primary care physician that starts the care for them. They may need to end up with a cardiologist or some other specialist, but having that relationship with someone that you trust and that you take advice from and that you develop an integrated plan with. Because it's not just the physician or the healthcare provider telling you what you should do. It's also the individual saying, I would like to do these things, or you have a give and take conversation so that it really makes a difference and you develop that relationship.
And Dr. Hartner and Mr. Murillo, what is available in our community for folks on that lower income bracket in terms of doctors and healthcare, and where can people go if they don't have anywhere to go or have the means or financial means?
In Lee County, Family Health Centers of Southwest Florida is a federally funded community health center. They see people with insurance and without insurance, and they charge based on the individual's ability to pay. So that's certainly a good place to go. If I agree with Dr. Schall, having a primary care physician is the ideal, But if you can't do that because you don't have insurance or whatever, you know, you can go to Publix and check your own blood pressure. There are health fairs here and there around town where you can get your blood sugar checked for free. The barrier always is, well, all of a sudden your blood pressure or your blood sugar is too high. Now you must find a source of care. But we can offer screenings for people, and I again want to emphasize the cancer screenings are very important. We've spoken a lot about the chronic diseases associated with diabetes and heart disease, but we can't forget cancer. Many cancers are also linked to obesity.
Right, exactly. And there are some groups in town, actually, and we really need to applaud them for their community service, that have developed clinics. They're essentially primary care clinics that people that don't have insurance can go into to get their care. Because generally what happens is someone without insurance ends up waiting too long, or they just end up in the emergency room for care that can be provided at a primary care office somewhere. So again, getting back to the policy changes that Dr. Hartner mentioned, we as a community really need to step up to the plate and say, these individuals will get sick no matter what. If we don't pay attention to the fact that they need care and that they should not necessarily get that primary care in the emergency room, we need to provide free clinics or subsidized clinics or some mechanism that gives them the care that they need and helps them to stay out of the emergency room when they don't need to be there, because again, that creates a lot more financial burden on the health system, and it becomes, again, a community problem.
And Wayne Nagy, in the school system in Lee County, there are nurses in the schools that can help identify if something doesn't seem right and maybe have a conversation with a parent or a grandparent about something that they see that may need some extra attention.
That is correct. The schools do have registered nurses that work in the school system that can get the information to the proper sources. Plus, we work very closely with the nursing group so that we can make sure that we work with the individuals that have special needs, special diets, diabetics, and individuals that need special foods. So yes, it's a good working relationship.
Let's talk about immunizations, and Dr. Hartner, I'm going to look at you for a lot of this. In recent years, there's been a lot of controversy over childhood immunizations, many parents electing to skip those shots for their children. Set the record straight on this issue. What is your recommendation for childhood immunizations?
Childhood immunizations are probably the second or third greatest public health intervention in the history of our country. Once we took care of clean water and sanitation, the next thing we did was prevent childhood infectious diseases. When I was in Hawaii, a professor of mine was a woman in her 80s at that point. She was a pediatrician. She walked with braces because as a child she had polio. She described in her internship in Buffalo in the 20s being up all night doing tracheotomies, cutting holes in children's throats so they could breathe while they were recovering from diphtheria. The next day, she learned that there was a vaccine. And now today, diphtheria, we don't see it.
Right.
It's gone. When I was an intern and you saw a sick child come in with meningitis, you thought of Haemophilus influenza, specific bacteria. We have a vaccine for that. The disease doesn't exist in children anymore. Mm-hmm. So we have made these enormous strides. And I know people are afraid of vaccines. Mm-hmm. And in fact, you know, over the last couple of years, we've added more and more vaccines for very good reasons, but it does frighten families a little bit.
And I want to get back to that in a minute, Doctor, about what they should be getting. Dr. Sell, I'm going to bring you in. Tell everybody, are they safe? And what about the concern that certain vaccines lead to autism? Two hot topics right now.
Well, I think where Dr. Hartner was leading is correct. The evidence really doesn't support that. And the evidence for your ability to wipe out diseases is so strong that I think that's one of the reasons that most physicians highly recommend that we stick to the schedules that are recommended for children and adults. And I know that parents, I'm a parent myself, you know, parents are concerned, you're giving your kids all these shots, but that's where the relationship with your physician or healthcare provider really makes a big difference. If you believe the evidence, you have to say, what is the scientific evidence that supports my concern that giving my child this immunization is going to cause this horrible problem? And you really have to get back to the scientific evidence and see if it's really clear. You know, we know that certain behaviors cause heart disease. You know, we don't know the mechanism of autism. It's been surmised that some of the vaccines do that, but the evidence doesn't really support that. So when you do a risk-benefit analysis, you say, if I don't give my children these immunizations, what's going to happen to them? And probably far more often, they will end up with significant problems down the road if they don't take the immunizations.
What do you say to a parent at home? Go ahead.
Let me jump in, because this year in the United States, we're suddenly seeing an increase in cases of measles. And the measles cases, when they're transmitted, are in children who didn't get their measles vaccine because their families were afraid of the link between measles vaccine and autism. Multiple studies show that there is no link. The original paper that proposed that link has been removed from the Lancet. You can't even read it today if you wanted to. So, but the point is, measles can be a very devastating disease. It can cause pneumonia in young children, it can cause meningitis, it can cause deafness. So it is not a disease to be taken lightly. And we're comparing the theoretical risk against the risk of a disease. In some ways, immunizations work too well, because many parents have never seen a case of measles, have never heard a child with whooping cough, have never seen mumps, and so they work so well, they're working against us.
You're on a roll, Dr. Harder. I'm going to let you keep going. What immunizations should children be getting?
Oh, you really are going to put me on the spot. Okay. What? Tetanus, diphtheria, pertussis. Tetanus we know as lockjaw. Diphtheria is a bacteria that causes a slime in the throat. Pertussis is whooping cough. Measles, mumps, rubella, hepatitis A, hepatitis B, Haemophilus influenza, pneumonia. When they get older, meningitis, particular kind of bacterial meningitis, especially for people going into colleges or the military. And I'm sure I've forgotten one. Flu shots.
Right.
I was going to get to flu shots. That's coming up.
But good for kids, too.
Okay. Let's hold off on flu shots for a minute. And I want to make sure everybody's clear. You're with Lee County, but your counterparts in Collier and Charlotte can provide the same information
Absolutely.
For people living in
Yes.
those communities as well, those counties.
Exactly, yes.
Okay. Let's talk about the flu shot. Who needs the flu shot? Kids, adults, both?
Both. Actually, probably everyone should get a flu shot. Anyone over the age of, I'm blanking, it's either 1 or 2. It's
Okay.
not good for infants, but for anybody else, should get a flu shot and should get a flu shot annually.
Dr. Sal, agreed?
Absolutely. You know, it's one infectious disease that people think is really a minor problem, but people die of influenza pneumonia. And when people don't get immunized, they could end up with major complications. So absolutely, it really should be, outside of the very young children, almost a universal immunization.
I think we have a question over here.
Yeah, I'm wondering about wellness. Most people consider wellness more of a luxury, just like retirement savings. And yet the best argument I've ever heard for wellness is somebody that said, well, that's my 401k.
Right.
How do you sell wellness in a time when people can't even meet their necessities?
Well, I have a slide that I actually use for some of my presentations that compares the amount of time that people put into investing financially for their retirement, so that they end up with a bunch of money in their 403B plans or whatever retirement vehicle that they use, and compare that to the amount of time that people invest into their health so that they are healthy by the time they get to their retirement years. And it pales in comparison usually, because people don't see the fact that they will either pay now or pay later. So I really try to emphasize the fact that you need to have a plan for your health just as you have a plan for your financial retirement. It shouldn't be a luxury, because I've had, as the other people on the panel I'm sure know of, situations or patients that seem to have everything going for them financially and otherwise, and they neglect their health, and bad things always happen in that situation. So I think you have to get back to the main priority of your day, which should be taking care of your health. If you maintain your health, everything else seems to fall in line.
You also have the luxury. I like that. It depends on who you look at. Some people say there's 6 aspects to wellness, and some say there's 3. And I like the 3 of, and it's my undergrad's kind of slogan, spirit, mind, and body. So maybe you can't focus on one section right now. Your life is not permitting you to. Focus on the parts that you can. You know, if your life has been restructured with a recent downturn in the economy, that you can't buy the healthier foods that you used to. You had to cut out your gym membership. You've lost your health insurance. Now look at what you can do, which is, you know, as you had said, walking, and just things like drinking water, taking time. You can't be at a health club, but turning the lights out, relaxing, the stress of everyday life, and just bring your body and your mind back into balance. There are ways to stay healthy that you don't have to be a member of a health club. Or have lots of money in the bank.
We have anybody else on that? We have another question from Anthony.
Dr. Sal, I have a question for you. I asked this question on the last panel. Maybe you can answer it for us. The question I asked is, in Lee County and all over the nation, we now see that African American females are now the largest carrier of the HIV/AIDS virus. We're currently working in the planning stages to have a symposium with the 3 county sheriffs in the Lee County, Collier County, and Charlotte County. One of the things that we're going to be asking them, and I would ask of you, is do you think it would be appropriate and cost effective if the health departments provided condoms for the sheriffs to put in their jail system, which would decrease the hopefully will decrease the transmitting of the HIV/AIDS virus?
Sure, I think that it would be helpful if they were used. You know, I guess the same argument has come up in the school systems in the past, and we can provide the recommendations to people to say, you should do X, Y, and Z to stay healthy. I wouldn't personally object to it. I would wonder if that would be part of the solution, only because this particular population may or may not take the recommendations. I think it's a major challenge for you all to deal with that problem. You'd probably have to base a lot of what you do to be successful on education. And if people really understood the ramifications of that disease, they probably would protect themselves more than they do now. So I think the answer to your question is yes, I would support that myself, but I would make sure that the education was strong enough so that people really understood the ramifications of that disease.
Thank you so much. Mr. Wayne, I have a question for you. A lot of times we see, I know a lot of people come to the SCLC office and they talk to us about issues concerning their children. Let me ask you a question. You have a lot of kids, especially minority kids, who may have behavioral issues. And sometimes that behavioral issues may be not having a father there to give them discipline and structure. They end up giving those kids, they label them emotionally handicapped and all of these things, and they put them on Ritalin and other medications, which there's a great debate about that issue. As the person who deals with wellness for Lee County schools and all of the school districts in the 3 different counties, what do you think about the seem to be overemphasis of Ritalin and other type of behavioral medicines given to young people, when it could just be needing a mentor or lack of structure and discipline in the home?
Well, I would think that'd be more of a question for the medical people in the group here. As far as working with the children, you know, we do have registered nurses in the schools, and they do their screening for BMI, they do the hearing screening, they do the vision screening, they handle the day-to-day activities and the concerns that children have. But as far as the big picture of Ritalin, I would think that the medical professionals would have a better handle on that.
Yeah, you know, I think it gets back to the issue of diagnosing properly. In the society that we live in, there is so much information available, and I see this every day. I mean, people will come into the office and say, I saw this advertisement last night on the TV, and they talked about this particular drug. I want that particular medication or drug, you know, however they term it. So at that point, you really have to say, number one, is it the right medication for you? Do you have the right diagnosis? And really, when it comes to all these behavioral problems that you're alluding to, I think it gets back to some healthcare provider sitting with the child and the family to make sure that you have the right diagnosis before you prescribe a medication. I've heard many people say, you know, my kid is hyperactive, he or she should be on Ritalin. Well, let's make sure that you have the right diagnosis before you prescribe a treatment. And I think if you can approach it from that perspective, we'd probably be treating people more effectively.
I think we've had a wonderful discussion. We have about 5 minutes or so left. So I want to give each of you an opportunity to maybe leave our viewers with a final thought, whatever you would like to share about your organization or about your feelings about wellness in Southwest Florida. We'll begin with Wayne Nagy, Lee County School District.
Well, first of all, we take the fact that we have to work with children on lifelong learning very, very seriously. One of the reasons we are the largest restaurant chain in Southwest Florida. We have 87 sites. We serve 12.2 million meals a year. We have to make sure that all of our meals are nutritious. We offer all of our children breakfast at no charge. Anybody that walks through our doors, and people would say, why would you do that? Well, we do get federal funding for that, but the most important reason is there's two more important reasons. One is nutrition-based and one is education-based. Nutrition is common sense. If we have good nutritious meals, it's a good start. Educationally, there's 110 studies that have been done that showed that hunger affects a child's health, development, behavior, self-esteem, attendance, and academic performance. And when you think about it, that's what school's all about. So we work on those areas. We try to get our Healthy Living Lab program together. We just won a United States Department of Agriculture Best Practices Awards for our Healthy Living Lab. I have testimonials from parents here that we're not going to get to that just love the programs because children are actually going home and talking to their parents and saying, yes, I'd like to have this. And we have a program called Fresh Fruits and Vegetables where you actually give children fruits and vegetables at no cost for a snack during the day. Federally funded, we went after a grant, we received it. This is a parent comment. I think this is worth spending the time. I just wanted to let you know that the Fresh Fruits and Vegetables snack is an excellent idea. I've tried for many years to get my children to eat healthier snacks. Sometimes it works, sometimes it doesn't. I told Allison and Logan that I was going to this grocery store this week and asked what they wanted for snacks. After 1.5 weeks in the program, they asked for pears and cucumbers. I was so happy. I was so excited. This is a typical email that I receive all the time. So we do take it very seriously. We want to do everything we possibly can to give nutritious meals to these children, and we will continue to do that for every day that they're in the school. We also have the school gardens. We have a power buying group where we can buy large amounts of materials, and how that helps us get more healthy things into the schools is before Land O'Lakes would say, okay, this is the mac and cheese we have. Now that we have 38 school districts together and we buy $200 million worth of food, we go to Land O'Lakes and say, this is the nutritionals we want in there, this is the amount of whole grains we want, this is the type of low-fat cheese we want, and we're getting things that are better for children. And if they start young, for example, in our Healthy Choices program, all the way up through high school. In our high school, we have some high schools that have 10 different areas that you can walk to. It's like a food court. They have a choice. Healthy choices, healthy choices, healthy choices, healthy choices, and healthy choices. They can pick anyone they want because whatever they pick is going to be healthy choices. No chips, no Powerade, no sodas, none of the things that aren't good for them. And by doing this from K and working all the way up through 12, we're hoping they'll go out and make the right lifelong decisions so that they can stay out of your office but still play tennis with you.
Absolutely, absolutely.
Follow that energy, Dr.
Well,
Snell.
that's exactly it. I'm really glad that Wayne is leading the charge in that area because that really is where it starts. We have to teach our children how to be healthy and how to make the right choices. Otherwise, we end up seeing them in our offices when they have chronic illnesses. I want to just take a step back for a second and thank you for moderating and everyone else for being on this panel because I think it's great that professionals will take their time to try and educate the communities to try and do the right thing and to be healthy. But, you know, the diseases that we've talked about for the last hour and a half or so, are, again, preventable to a large degree. So if we can really focus on what things we need to teach our children and our adults to stay healthy and to avoid these chronic illnesses, we will be so much better off as a society. So prevention is everything. Stay healthy and you'll lead a happy life.
Beth Jamieson, Director of Wellness, NCH Healthcare.
I agree a lot with what you said. The company I work for, NCH, the forefront of their mission is promoting health and wellness. We're always going to be a repair shop, as our CEO puts it. But at the same time, we'd like to take care of the person before they wind up being ill. So hopefully people take the information they've learned from this and work on their healthy lifestyle. And just because you might not have the access to the most money or the best food, at least work on some other portions of it. Wellness, as I said, it's a spirit, mind, and body. There's 3 portions to it. You're going to live in your body for 100 years. Treat it right, and if you need any help, reach out to the community. We're all here to support you.
Leslie Amrick, American Heart Association.
One of the free tools that I forgot to mention earlier that the Heart Association offers is a website called My Life Check, and it's 7 different areas. It's going to give you a score from 1 to 10 on your heart health. And we did some surveying nationally, and about 40% of Americans believe they're in good cardiovascular health. In all actuality, it's less than 1%. So part of the battle is knowing where we're really at. And that website is www.heart.org/mylifecheck, and it's totally free, and it's going to give you an idea about where you are and what are some areas that you can work on. It's free tools to help get you there. So like all of my colleagues today, we just encourage you to do what you can, take one little step at a time to make a difference for your health.
Dr. Judith Hartner, Director, Lee County Health Department.
I'm going to go to 2 more prevention areas that we haven't talked about. Sure. The first is injuries, especially motor vehicle crashes, is the 5th leading cause of death in Lee County. So don't drink and drive, don't text and drive, wear your seatbelt, wear your bicycle helmet while you're out there getting your good healthy exercise.
Right.
Watch for children around water. Elders, make sure that there are no trip hazards, because falls are a leading cause of broken bones and head injuries in senior citizens. So injury prevention is key. And the other is along the line of Mr. Thomas's question, and that is our choices in behavior relative to sexual activity. HIV/AIDS, other transmitted diseases, unwanted pregnancies, all are preventable based on the choices we make in our behavior.
Good job.
Last but certainly not least, Jose Murillo, Charlotte County Regional Medical Center.
We talked earlier about how businesses might be able to be involved in health and wellness, and I get to lead a hospital that has a wellness center just right across the street from it, and among the many things that we have in there, besides speech pathologists and occupational therapists, physical therapists, exercise technologists, we've got massage therapists. And it's designed mainly for the general public, but what we've done is we've designed a program for the employees where if they commit to coming in 3 times a week, it's not going to cost them anything to come work out at our center. Otherwise, it does cost you. So we've tried to create something to promote for our employees. Now, we can make it that complicated, or we can make it as simple as we've done in our hospital, which has been great for morale. Charlotte Regional Medical Center's Biggest Loser program. At which right now they're in the middle of competition, and next week we decide who the winner is going to be, and just to promote, appropriate weight. Any business can do something like that. So I guess my challenge would be to the businesses of the community is to think about the health of your employees and see what you might possibly be able to come up with.
All right. Thank you all for your time.
Thank you.
Thank you.